when you come here, it's just like being part of a family. It really is.
To come to this unit, to be one of 21 centres in the UK, has been a stupendous journey.
And I would ask anybody to give it serious thought, because it does help and it helps others.
In March, the Trust officially marked the launch of a new commercial research delivery centre at Bradford Royal Infirmary, a major milestone not just for the Trust and Bradford Institute for Health Research, but for research across our region. In this episode, we'll hear from Dr Dinesh Saralaya, Director of the Commercial Research Delivery Centre, about what this new development means and how the centre is helping to place Bradford alongside our partners in Calderdale and Mid Yorkshire at the forefront of commercial research. We'll also hear from patients involved in research who will share with us their experiences of helping to shape better care.
So after a very competitive process, Bradford Teaching Hospitals was selected to host one of 21 NIHR commercial research delivery centres across the UK, 15 of them in England alone, and we are one of 6 centres in the north of England. What this centre does is allows access to our patients to late-phase clinical trials under the auspices of the National Institute for Health Research through a government-funded programme of over 72 million across the country. We will have access to cutting-edge technology for our patients, newer treatments for various disorders. Today is the formal launch of our CRDC. We've had members of the research teams from our 2 partner organisations, namely Mid Yorkshire Teaching Trust and Calderdale and Huddersfield Trust. Our entire research teams, including our senior management team. We've had members of the Trust Board visit us this morning, but we've had memberships from industry and big clinical research organisations who have come and shared their thoughts on what has it been working with Bradford in the past and what they see the future of this partnership. We've had young researchers, various consultants, even trainees and general practitioners attend the event today to see what we do well, and what we can do in the future to enhance research in our community.
I've got brittle asthma. I've had it since I was about 30. Went to the GP and he said to me, I think maybe, these drug trials are coming out now, so let's go for it. It's been just over a year now and it's been fantastic.
I had COPD. I started this trial 12 months ago, just over. Been on numerous trials, but this is by far the best one I've been on. It's really helped me, and I hope it helps others. I first was introduced to it by Dinesh. He suggested coming on trials. This is about the 4th one I've been on, and I would ask anybody to give it serious thought, because it does help and it helps others. And it's so good, it's so easy. The staff are lovely. I come once a fortnight, get my injection and go home. They supply the transport, they supply sandwiches, coffees. It's lovely, and I would advise anybody to do it.
I'm excited that I'm taking part in all the research, and when you come here it's just like being part of a family. It really is. If you've got any problems at all, I just have to ring them. Whatever I need, it's all done straight away. But with the injection it's been brilliant. It's worked for me as this one, and I would just tell anybody to just try and get on any of the drug trials that's pertinent to their health problem, because it could help them and help other people.
The grant runs for 7 years. We hope to become the most successful CRDC in the country. We want to make sure that the city of Bradford shines in the way it conducts research, the quality, the speed, as well as the number of patients we recruit. This journey started back in 2009 when I started doing clinical research with a very small team right in the basement of our Bradford Royal Infirmary. To come to this unit, to be one of 21 centres in the UK, has been a stupendous journey, what I would call historic. But that couldn't have been done without our patients, the support from our organisation and the team that I have around us. So it's a huge pride and privilege to be leading this endeavour across the trust, but also for our patients. We couldn't have done it with all the patients that come to our hospitals, because without their support we couldn't have run a trial centre which was successful. And it's also going to be for the patients in the long term and look after them as well.